Hello, I'm Taylor Johnson with New Perspectives at WOCS 93.7 FM, the People Station. And joining me today is none other than the radiation oncology specialist here in Orangeburg at the Cancer Center, Dr. Paul Gutowski. How are you doing, Dr.
I'm
Gutowski?
doing great.
Good.
Not bad for a Monday.
Oh,
Of course, we get extras on during the week.
Don't you just love Mondays?
Absolutely.
I do too. So, Dr. Gutowski, talk to us about what it is that you do.
Oh goodness, radiation therapy or radiation oncology is a specialty. Is a specialty where we use radiation to treat patients, usually with cancer, although we do treat some benign diseases as well. It has become probably one of the most important subspecialties for that, along with chemotherapy. Used to be considered that cancer was a surgical disease. If you can't cut it out, you can't cure it. Now we've realized that it's important to use all the tools to their best advantage. So it may be some surgery, some radiation, some chemotherapy.
Okay. I've always had this question, and I'm pretty sure you, out of anyone I ask, can answer it. How exactly do people get cancer? Is there a certain trait that they're born with, or is it just natural?
Some cancers are genetic. We do find some patients with family trees that have a large number of cancers in family members. For most patients, though, it's a random event, or it may be related to things that they do themselves. Definitely tobacco. Smoking is a very key risk, particularly for lung cancer, but for other cancers as well. And in fact, we're very actively involved in a study with DHEC and the university to try and help patients to stop smoking. That's the most important thing that they can do.
Very true. So I know you have colon cancer, pancreatic cancer, breast cancer. There are so many different types of cancer. So is one cancer more deadlier than the other, or are they all just weighing the same amount of tragic?
No, some can be much easier controlled. Leukemias, lymphomas tend to carry on for years, and you're able to keep it subdued. It becomes a more chronic disease. Prostate cancer is something that often has a many-year history, and in fact, one of the biggest issues in the medical media today is what prostate cancer patients really need to be treated. Some patients can live with their disease without it having to necessarily go through radiation or chemotherapy or surgery. Some cancers, though, are very, very aggressive. Brain cancers are probably one of the most aggressive.
Wow.
And that often hits young people. Consider 50 young.
Yeah.
But typically 50-year-old patients are the most commonly affected. And they're in the prime of life. They've got families. They've got work and business that they're dealing with. And all of a sudden, this is something that comes out of the blue.
Wow.
And it's difficult for us to cure those patients.
Oh, wow.
So yes, it's a wide variety. So cancer is not one thing.
Okay. I was just about to ask, you mentioned age. So I was in a conversation with someone just the other day that age does not really define cancer. You can have cancer at the age of 2, the age of 15, the age of 60 and 80. And you know, it's just amazing that it can just happen to you so young. So what are like symptoms for cancer, different cancers?
Probably the most important things that we can try to look for and affect a cancer before it becomes a serious problem. Cough, that's a good indicator for something like lung cancer. Sore throat that doesn't go away. Headaches that get worse. And bleeding, certainly that's something that, particularly colon cancer, one of the most important symptoms is just simply often passed off as hemorrhoids.
Oh, wow, wow, wow. So talk to me about treatment and radiation. What exactly are those?
Well, like I said, radiation is one of many tools for treating cancer. It uses actual radiation aimed at a tumor. And people think, oh, radiation, and think all kinds of oogie things. But quite honestly, used properly, it's a very safe tool. And the radiation damages the DNA that the cells use to produce new cells. Cancer cells are growing the quickest, so they're going to be making new DNA copies the fastest, and they're the most easily targeted. Whereas normal cells grow over a much slower period of time. And so they're able to repair that damage before their next cycle. So that's one of the ways that radiation is used. Also, we can aim it, and with the tools that we have now, it's phenomenal how tightly we can focus the radiation into tumors, even the size of a peanut. Give very high doses and have patients walk away with virtually no side effects.
So now we're here with Dr. Kotowski in the vault. So Dr. Kotowski, where are we? What exactly is this?
We're deep underground in the bunker. We're actually surrounded by a minimum of 5 feet of concrete. Some areas in the direct line of the beam are as thick as 7 feet, particularly overhead, so we don't knock out any of the stray helicopters flying above. But the shielding is important for the safety of everybody, including the staff who work here. I have to wear a radiation badge, but I very rarely have any significant exposure. So it's a safe area to work. It's also a great place when the weather turns really bad.
Wow.
This place will stand up everywhere.
I believe it.
This is the linear accelerator. This is our main tool that we work with. It produces radiation beams somewhere between 6 million and 15 million volts of energy. Imagine a light bulb that puts out about 50,000 watts. So with this and with the technology that we have now, the Trilogy is really the main workhorse. It actually has computer controls inside that allow us to shape the beam and change it on the fly while the machine's rotating. And also we have onboard imaging so that we can take like a regular x-ray or even create something very close to a CT scan while the patient's on the treatment table being treated. So if there are minor adjustments that we need to make to get them within our 3 millimeter accuracy that we're shooting for, we can do it right then and there before each and every treatment.
Okay, so you're leaning on something right here. What exactly is this that you're leaning on?
The controls aren't turned on for me to bring it up and down, but this is the table that the patients lie on. And with this, it moves back and forth, up and down, side to side, all remotely from where the therapists are working on the patient outside. And we have, again, millimeter accuracy on the positioning of this table. You see some notches in the table, so we can actually set up patient positioning devices, latch them to specific points, and we'll have them set up within such a tiny amount that it's hard to put a piece of paper between them and where they're supposed to.
How often do you feel like some things make it difficult to you as you're working as it pertains to cancer? Like sometimes you may just feel like, wow, like you may have to go the extra mile focusing more on one cancer than it is the other. How difficult does it get?
A lot of it has to do with the capacity of the patient themselves. If you have somebody who is younger, good physical condition, this is a blip in the road that you need to make sure you've got it taken care of because they have 20, 30 years ahead of them. That patient, you often have to work harder because you have a much longer period of time that your effects will be seen. Mm-hmm. Older patients, though, aren't necessarily, just because a patient's old doesn't mean they're past the point of treating. We have, I have patients commonly in their 70s and 80s, who even right now we have 2 patients that are in their 90s.
Wow.
And they tolerate it very, very well. And it's some cancers you have to control regardless of the age of the patient.
Wow. And is there a certain amount of checkups? Like, do you have to come in for checkups for, let's say you don't have cancer. Is it smart to come in just to get checked to see? I know sometimes you can get checked for breast cancer, but what about different other cancers?
Trying to find a cancer when it's small and before you know it's there is the most valuable tool that we can use. An early cancer is much easier to deal with than an advanced one that a patient knows they've had and have been trying to hide it or avoid it. Mammograms on a regular basis for any woman over 50. PSA over the age of 50 for men. And that's being debated, but still we find prostate cancers at a much earlier and much younger age with screening. But the one thing that most patients don't take advantage of and can make a huge difference is colonoscopy.
Wow.
Colon cancers still are very prevalent, and a colonoscopy on a regular basis can make a huge difference in whether we can cure that patient or not.
Wow. So how often do you see patients or women that get ovarian cancer?
Ovarian cancer is a much more difficult topic because there aren't very many symptoms that really tell you something's going on, and it's difficult to find it on a pap smear or any of the routine screening. So ovarian cancer is one that unfortunately we still have to wait for a patient to have symptoms. Ultrasounds look promising. Some other genetic testing may give us some value, but right now those are 3-5 years off.
Wow. And there are some old tales that I know a lot of people I hear around the town say that if you eat certain foods, it can keep cancer away. Is that true, or is that just a little myth?
Well, to some extent, antioxidant foods, vegetables, your mother was right. Eat your vegetables. Certain types of vegetables like cauliflower, broccoli, cabbage even, can have a high level of antioxidants that can be very protective. Grilled foods can, on the other hand, can be harmful. Of course, I grew up
Really?
in Nebraska, so grilled steaks, that was common.
Wow.
That was as common as barbecue here. And the grilling process can convert some of the contents of the meat into a more toxic substance.
Wow.
Yeah.
See,
So-
I just learned something just now because I always thought that grilled food was probably the best food to eat compared to fried food, but really it's not too
No,
good.
not especially if you get it nice and charred and
Wow.
with the black stripes and all
Wow.
everything that makes it look so inviting. But broiled is probably the safest way to cook.
Wow.
But an occasional steak is not going to kill you. But making a regular diet of hamburgers and French fries every day
Wow.
of the week, that's not so good.
So what advice would you give our New Perspectives listeners as it pertains to cancer? What advice would you give them the importance of knowing about your situation as it pertains to cancer and being aware of cancer?
There are set rules for screening that any primary doctor, any family practice physician is going to know about. And when they recommend that you get a PSA, a rectal exam, a colonoscopy, a mammogram, any of those things at the times that they're supposed to be, follow up. I mean, follow their advice. They're there to help you, not to make you feel miserable. But if something's happening that's not going away, if you get a cold for a couple of days and it goes away, or a headache or something like that, but if you have something that's continuing on for days or even weeks, please see somebody who can do something about that.
You guys be sure to see your doctors, follow up, be sure to just keep yourselves in the right place as it pertains to cancer, know your status, and make sure that you're in good hands with your doctors. I'm Taylor Johnson with New Perspectives Media on WOCS 93.7 FM. This has been a production of New Perspectives Media, a part of the People Station, WOCS 93.7 FM, located at 1581 Russell Street, Orangeburg, South Carolina. New Perspectives Media is sponsored by Orangeburg Consolidated School District 5, Regional Medical Center, the Department of Public Utilities, Jimmy Jones Toyota of Orangeburg, National Kidney Foundation, Curry Insurance Agency, Dean Law Firm. For more information about upcoming programming, tune into 93.7 FM, The People Station.